Hi everyone, thanks for tuning into the YouTube channel. We're going to talk a little bit about neurotransmitters and how they affect your health and your overall health. And what are neurotransmitters? Those are basically chemical compounds that your nervous system and your central nervous system, peripheral nervous system use to help function. So things like serotonin and dopamine and GABA and histamine and glycine and glutamate, all these things, norepinephrine, epinephrine, that help your body function. And one of the things that people don't realize that you can actually look at your neurochemistry or your neurotransmitters through the urine. That's something we've been doing for years. I had a history of concussions, so I had the ramifications as I got older due to repetitive concussions, which led me into a whole new field of study, which led to autism and depression, things like that. And we've been able to help many, many people with this simple neurotransmitter test. But one of the things that people don't realize is that things like your adrenal gland, which is your DHEA and your cortisol levels, there's also another side called epinephrine and norepinephrine, or your adrenaline. And those compounds play a huge, huge role in inflammation and even cardiac disease and the onset of a sudden cardiac incident. So we can kind of look at some of the neurotransmitters and the new cardiac markers to see where you're at as far as a cardiac risk, which to me is of great interest. I have a family history of heart disease. My father had a 5-way bypass at 63, which he had really no signs or symptoms past stress test, thallium stress test. It really wasn't until he had an angiogram that they found the significance of what was going on. And the thing is that he was like many men in society today. His first heart attack would have resulted in death. So if you'd like to know more about it, I suggest you subscribe to our email. You can go to pintohealthcare.com. Keep checking into our YouTube channel. Contact us at pintoantiaging@gmail.com. But just get a hold of us and we can talk to you about some of the new cardiac markers or the uses of neurotransmitters in depression and clinical application for even athletes, something that people wouldn't even think of doing. So I'm an athlete, always been an athlete. I think once you're an athlete, you're always an athlete, especially if you have an interest in it. Again, thanks for tuning in. We'll see you next time. Thank you.